Where's Mike? Mike, Diane and Dementia number 17. The "Where's Mike?" interrogation is causing me to grieve. The slings and arrows of outrageous fortune. Shakespearean torment. Hamlet's uncle murdered his father and married Hamlet's mother. That will cause grief. According to the American Psychological Association, grief is best described as anguish. It's experienced after a major loss, usually the death of a loved person. For example, my original version of Diane, a vibrant, funny, brilliant personality, which is dying a slow but steady death, like someone gasping for breath underwater. Anguish is a fancy word. When you ask someone how they are doing when they are suffering, you never hear people respond, "I feel anguish." More likely, they respond, "I feel like shit." Anguish involves extreme unhappiness caused by physical or mental suffering. The APA claims that feeling grief includes physiological distress, separation anxiety, confusion, yearning, obsessive dwelling on the past, and apprehension about the future. That's quite a payload. If you weaponized it, you would have a dangerous force capable of causing mass destruction. Intense grief can become life-threatening through the disruption of the immune system. It causes self-neglect and can lead to suicidal thoughts. Grief may also take the form of regret for something lost, remorse for something done, or sorrow for a mishap to oneself. Welcome to my miserable world. With Diane's aphasia and Alzheimer's disease causing her progressive cognitive decline, I have experienced most of the above. Swiss-American psychiatrist Elizabeth Kubler-Ross in her 1969 book, On Death and Dying, proposed 5 stages of grief. Terminally ill patients supposedly experience this process when confronting death. Later, they applied it to grieving friends and family, who underwent a similar process. The stages are as follows. 1. Denial. 2. Anger. 3. Bargaining. 4. Depression. 5. Acceptance. She noted the stages were not necessarily linear or predictable in progression. Her critics took issue with the hypothesis. That's what critics do. But they identified the loss of a spouse as the number one stressor because when you lose a spouse, you lose your support system. And often your home, your income, your security, your past and your future. Again, welcome to my gloomy world. This is a YouTube video based on my Facebook entries on dementia. I welcome your thoughts and prayers. If you are engaged in similar struggles, I also welcome your likes and suggestions.